After prostate cancer treatment, I think it's essential for men to evaluate and see what areas has their treatment impacted their life and where can they improve the quality of life. For most men, this involves an evaluation of stress urinary incontinence and or evaluation of erectile function. The reason to see a men's health specialist such as myself is because we're fellowship trained and can look at and discuss all the different treatment options that are available. For some men, prostate cancer treatment, whether it's radiation or surgery, even in the best hands, is going to have impact on erectile function. The key part to note is that there are treatment options available if you do have issues with erectile function, both in the short term and long term after your treatment. Regardless of your treatment, radiation, or surgery for your prostate cancer, we know that there can be some impacts on bladder function. For some men, this comes down to urgency or feeling the need to go to the bathroom, and we've got treatments for that. For some men, this comes down to stress incontinence or leakage with cough, laugh, sneeze, and there are various treatment options, both short-term and long-term options, to help you get past these issues. The recovery process after prostate cancer treatment involves a couple things. One is your goals. Two is looking at the things that have been affected by your treatment, including erectile function and urinary leakage, and then looking at treatment options for that. Typically, we look at these in the short-term area, meaning the first couple months to 6 months after surgery or radiation, and then longer term, which means 6 months to a couple years afterwards. In the short term, we're looking for short-term options that may, as things improve, just help you get to where you need to go. And then after that period of time, we look at longer-term solutions or options that may be needed for some men who have longer-term issues. I think the most important thing after treatment for prostate cancer is seeing a provider who is passionate and interested in treating the issues after your cancer is treated. And that's looking at erectile function and leakage of urine, and finding someone who's really passionate, such as myself, about finding solutions to your problems. For men who do have long-term erectile dysfunction after prostate cancer treatment, there are cures which help. We obviously start with things like Viagra, Cialis, and for some men that can be enough. But for lots of men who have long-term issues with erectile dysfunction, we talk about curing this and treating it. That can come down to injections or a penile implant, which is an outpatient surgery and helps cure and fix your erectile function and restore it back to where it was. Most men will recover some continence in their first few months, up to 6 months after their prostate cancer treatment, after prostatectomy especially. For men who have issues longer than that, we start talking about more long-term treatment options. Those treatment options typically come down to a male sling, which is an outpatient surgery, or a artificial urinary sphincter for men who've got worse incontinence. To decrease issues with length and girth after prostate cancer treatment, it's essential to see someone who's interested in helping you fix the problem. What that means is getting erections back as quickly as possible after your treatment and getting them back on a regular basis to maximize your length and girth and fulfill that recovery that we're looking for. I think health after prostate cancer treatment is one of the most important things. What that obviously means is eating well, exercising, and a lot of those things also mean getting your physical and emotional strength and health back. For a lot of patients, that involves getting intimate with their partners. It also involves having discussions with friends and family and kind of getting back to a normal life related to post-cancer treatment.